Now, live from Studio 550, this is the McGraw Show on KTRS.
It's 9:15. Dr. Boain from Boain Dental Care on Dunn Road. Just, at one block, north? One block north of Johnny Londuff Chevrolet? West of Johnny Londuff Chevrolet.
Yeah.
So you can buy a car and get your dental implants all on the same block up in Florissant. Good morning, Dr. Boain.
Good morning.
You brought in some show and tell things for us to check out, and dentures and implants. I'm getting a lot of topics have been a conversation here quite a bit, so we brought you in here to talk dentures as well as implants, and you brought some show and tell for the people who are watching on TV. Let's start with implants, which is something you've explained to me. Explain implants, because you're now telling me, well, first explain implants and how it's different than just pure dentures.
Well, as far as dentures, we can add implants to stabilize the denture and keep them retentive and not having to use the glue, and then also give it a more realistic feel when they chew. So you can do it like the model you're holding there. You can do 2 implants just to give some retention so you're not having to glue them in, versus doing multiple implants where it's completely implant supported.
Right, but dentures are basically just a tray of teeth that you get the glue or the Pepsid into, whatever it is, right? And you put it on there and you squeeze it down and the glue kind of comes out and you just sort of, your dentures then move around while you can't eat corn on the cob or anything like that. And that's how it's been for years.
Right.
Implants, it's quite ingenious actually. You put, what do you call that, a bar or some type of...
It's a titanium fixture that goes into the jawbone, yes.
And then that attaches to the dentures.
Yeah, think of it as almost like the tooth root of a tooth is the actual implant, and then you can put any kind of attachment to it. Like the one you have there is almost like, I describe it as like a trailer hitch, like a ball and joint, type of attachment where it has some freedom to move, and it has to be non-rigid just because you only have 2 implants in there.
Right.
So you add more implants, it's like adding more teeth or roots, and it can become more stable.
And so a dental implant you can do on 1 tooth, 2 tooth, 3 different teeth, or what you're telling me now is that if somebody has dentures now, you can actually retrofit the current dentures into these implants.
Yes, that is correct.
So if someone's complaining about their dentures moving around, you can put this implant in, and their current tray of dentures can be used as a permanent fixture with these implants.
That's right. And to be honest, it's probably one of the most rewarding things I've done, because people come in and I consider them almost like a dental handicap. They're not able to eat what they want. They're embarrassed. Food's getting underneath their teeth. And they're, like your colleague was saying that, his grandmother would leave the room to eat. We can add these implants, and then now the denture is stable in their mouth and they're chewing with confidence.
My grandfather had dentures, and he used to always snap his dentures.
Clickers and clackers, we call them.
And it was always, I wasn't very close to this grandfather, but I was always like, why does he make that noise? Like that's his dentures. Yeah. I guess because they're
that loose in there.
They were hanging around his mouth, and he had. But this is amazing that you can actually. It's like it must be rewarding, because if people can't eat steak anymore, can't eat anymore, you're actually giving them ability to live again.
Yeah. And I've had plenty of people say they can eat corn on the cob now and things like that. It's a great service.
You gave me an actual dentures. Right? What am I holding up here?
You're holding a denture. The clear part is simulating their jawbone.
Right.
And there's 2 implants in there. Okay, that would be kind of like doing the minimum. Just you want more stability in your denture. You add 2 implants. It's also a lot more economical option.
Right.
And you can go to something that's more like, the one I'm holding here is 4 implants that actually has a bar connecting them and gives you a lot more stability. You can imagine, you spread these out. The way I describe it is you've got like a 2-legged chair there. It's going to be able to wobble both ways.
Right.
You could do a 3-legged chair, like a tripod effect, and get a little more stability, and 4 is like a 4-legged chair, and it's very stable. And it's when you chew, the force is actually being loaded down the long axis of the implant. So now you're getting a more realistic feel. You're not getting as many sore spots and things like that, because before it was completely supported by tissue where plastic's just rubbing on it. And then you got geriatric population that's on medications and things. They're getting dry mouth and they get tons of sore spots. And we can almost eliminate that with the implant.
Tell me about the procedure to put the implants in your jaw. How difficult is that?
Well, depending on how extensive, I mean, like a 2 implant, like you're holding there, basically you go in and you just, drill the holes for the implants and place them in. I mean, we spend more time planning it than we do the actual surgery.
So the surgery, what, an hour? A little over an hour?
If that.
Really?
Yeah.
And then how soon will everything go back to normal? A week or two?
Yeah, I mean, I don't want to even say this because a lot of people don't believe it, but it's like I have so many people I put an implant in, and they're like, I went home and took a Tylenol, and that was like it. It's amazing because, I mean, you just don't have the same pain receptors in the bone itself. So, and then I allow it to heal for a while before we go in and load it. So we put some healing caps on it. They leave with their same dentures the same way they've been going. And then later we put the attachment in the denture.
Something you said to me that I did not know, and that was if you lose a tooth or lose a couple of teeth, and even with your dentures, if the bone in your jaw starts to deteriorate once you lose your tooth.
Yeah, I don't know if you want to hold this model up for your viewers. Yeah, basically, have you ever heard like an astronaut going into space? They're up there with no gravity. There's no stress on the bone, right?
Right.
So they come back and they have to actually rehab their bodies and increase the bone density. They lose bone density because they're not stressing the bone.
Sure.
So now on someone that loses all their teeth, you're putting a denture over the tissue that supplies the nutrients. That's, now you're suffocating the tissue. You're also not using the bone. So implants is the one thing in dentistry we can actually put an implant into the jawbone and it'll preserve the bone because now you're using the bone. So you don't have that what's called disuse atrophy.
And
phenomenon.
so those pictures of those old people where they have no teeth and their sort of jaw is sort of deteriorated, that's because the bone has gone away.
Right.
Yeah.
You've got the sequence of time there, what happens to the jawbone.
That's
Basically, the teeth are lost and the jawbone slowly over time shrinks. And I always hear this, this denture never fit like the first one, or they're on their 3rd or 4th denture, and they always want one like their first denture. And it's like, well, that's because the anatomy has shrunk away, and now you don't have as much for the denture to sit on. Unless it was just poorly made the first time.
I should also say, Dr. Boain of Boain Dental Care, you have gone and let's give you a plug for your education. You have gone to the ends of the earth to get certified in all of this dental implants, right?
Yeah, I mean, there's no certification. I mean, I'm licensed to do it coming out of even dental school. But what I went on to do is do a residency in implant dentistry through the American Academy of Implant Dentistry, which has been around for 75 years. I mean, they're kind of the leaders in the education part of implant dentistry.
And then how new are these implants? I mean, how new is this technology?
Really, it's been around for a long time. And the design has changed or evolved over the years to what we call, those are root form implants, where it's almost the shape of the root, hence the name. So, I mean, before they used to use blade style. I mean, it's really evolved a lot, and the success rate on this they've found to be the greatest.
I mean, it's really something that a lot of people don't know about.
Right.
Some people know about dentures, but we want to highlight it here because, as you said, if this is the most rewarding thing you do in your practice, this is giving people a whole new life if they've lost dentures. And I've talked to some of your patients who've done it. And they say you wouldn't believe my life is new again, and I'm not embarrassed. My teeth don't fall out, and it might be funny, but it's a serious issue people have, and there's a simple way to fix it. So I mean, it's extraordinary. All right, that's Dr. Boain. You want to hang around for another segment?
Sure.
All right, take a couple phone calls or two, maybe.
Yeah.
Got any questions? 314-968-9600. 314-968-9600. That's not even. Is that the phone number? That's not even close to the phone number.
921-3500.
Well, that's the phone number to Altair Travel. So if you want to take a trip, call Altair Travel. If you want to call Dr. Boain, 314-969-KTRS. That's the phone number of the radio station. 314-969-KTRS or 1-888-550-KTRS or star KTRS. If you want to call Dr. Boain, you can call him 921-3500, right? 921-3500. Or find out more at boaindentalcare.com. But if you have a question about implants or dentures or your teeth We'll ask the dentist segment coming up here on the Big 550 KTRS. Another quick segment with Dr. John Boain. Family dentistry. Your father was a dentist for how long?
5 years.
35 years. You got the bug? Were you forced to become a dentist, or did you want to be a dentist?
No, I wanted to be.
Yeah. Did you go to work with him as a kid? And
I was in there a lot. Yeah, actually having my own dental work done, so I kind of know what it's like to be in the chair.
You sweet-talked your wife when you met her at dental school, right?
Correct.
So you sweet-talked her into coming down to St. Louis?
Yeah, she's from Wyoming.
And you have the third generation of dentists on its way, right?
Braxton is in training right now, coming into the office.
It's a great family affair out there. And you were saying on the break, some of the most rewarding work you do is this dental implants, but you also find yourself, a lot of people calling you up and just asking for a second opinion, and you're happy to have them come in and just give a free second opinion.
Yeah, anytime. And we've done for your listeners in the past is a free CT scan if they wanted an evaluation for implants.
But, I mean, because you certainly, this is, even though we talked about how, quote-unquote, simple it is, it's still surgery. And sometimes if you want to make sure you're getting the right deal, the right price, the right procedure, the right implants, nothing wrong with going for second opinion.
Right.
Simple as that. All right. Anything else in the dental world we should know about? Brush your teeth, brush down, right? Brush down and brush up.
Squiggles. You
taught me to
No, the hygienist would have been the one teaching you.
Oh, okay.
I didn't tell you.
You told me to brush down, away from the gums, right? No?
Well, yeah. I mean, definitely want to get near the gum line. Yes, you want to get the plaque off there.
Yeah, and you want to. I thought you wanted to like cock it a little bit and then go up.
Yeah, you hold it at an angle.
Get the bristles
down by the.
Because if you brush side to side, that basically does absolutely nothing.
Yeah, if you're just scrubbing like that, that's not doing any good.
You're just wasting your time.
Yeah.
Does it matter what toothpaste we use?
No.
What toothpaste do you use?
What toothpaste do I use? Really? Colgate.
Colgate.
Total.
All right. Colgate. Well, do 4 out of 5 dentists really recommend Trident gum?
It's a great thing.
All right, good. Yeah. Dr. Boain Dental Care in Florissant on Dunn Road, Highway 270 and Dunn Road, right next to Johnny Londoff Chevrolet. So go and get your dental implants. It's a full-service dentistry, right? Also orthodontist too, right?
Yeah, we do full scope of dentistry there, and that's what I like about the implants too. I'm with them start to finish, and I oversee the whole thing.
You got it. Have a good week, Doctor. Thanks for coming in.
All right. Thanks for having me.
You got it. Dr. John Boain, give him a plug. 314-921-3500 is the phone number, boaindentalcare.com, or call if you have any questions about dental implants or dentures and all of that, whether it's a root canal, tooth cleaning, whatever it may be, dentures, orthodontics, all that stuff. I am a proud customer of Boain Dental